It's usually tolerated very well, but a small percentage of patients may experience. Good afternoon, everybody. Dr. Sharma here. One of the more common questions we get from patients is, what's the difference between finasteride, oral minoxidil, and dutasteride, and which treatment actually works best for my case? So today, I'll explain how each option works, who they're best suited for, and how long they usually take to show results. Now, let's start with oral minoxidil. Minoxidil works very differently, as it doesn't actually affect the hormones at all. Instead, it helps increase blood flow and nutrient delivery to the follicles, which may help stimulate new growth or strengthen thinning hair. It can be either applied to the scalp or taken orally. It's particularly helpful in areas showing miniaturization. However, it doesn't stop the underlying cause of the hair loss. For that reason, some patients use minoxidil together with finasteride, rather than as a replacement. You should also know that temporary shedding in the early stages is entirely normal. It's often just the follicle preparing to reset and enter a new growth cycle. Most patients will start seeing meaningful change between 4 and 6 months, with further improvement over time if used consistently, and that's the key, consistently. Finasteride is taken once a day and works by blocking DHT, which is the hormone responsible for shrinking hair follicles over time. By reducing the DHT levels, it helps slow or stabilizing ongoing hair loss, especially around the crown or hairline. It normally doesn't regrow hair a significant amount on its own. However, it does play a critical role in preserving what you still have. And that preservation becomes critically important before and after a hair restoration procedure. Some patients begin noticing improvement around 6 months, though it may take up to a year to assess full benefits. It's usually tolerated very well, but like with any medication, a small percentage of patients may experience hormonal or sexual side effects. This is something to discuss with your own individual provider. Now, let's move to dutasteride. Dutasteride is similar to finasteride. It's used off-label, but generally it's more potent. Whilst finasteride blocks one type of enzyme responsible for converting testosterone into DHT, dutasteride blocks 2 of these enzymes. Because of this broader action, dutasteride can lower DH levels more comprehensively and may be considered when finasteride has not provided sufficient stabilization. However, due to its increased strength, it may also increase the likelihood of side effects, so there is no free lunch. It's really something we typically reserve for certain cases where the potential benefits clearly outweigh the risks. Not everyone needs it, but for some patients, it can be a valuable option.